Informed consent prior to immunization. Consent for series process. Initial visit in series, example 2 months. Parent has reviewed standard information. May 2013. Health clinic visits involve complex conversations, including informed consent, health assessments, and other health issues. There is a difference between obtaining informed consent to immunize and deciding to do the actual immunization. The health assessment and eligibility and contraindication determination are aspects of the decision to immunize using clinical judgment. These are all outside the scope of obtaining informed consent. The purpose of this demonstration is to obtain informed consent prior to immunization when the client has reviewed the standard information, and to discuss how family members can bring the child to the clinic. The process for obtaining informed consent consists of 7 steps and is outlined in the BCCDC Immunization Program Manual, Chapter 2. During an immunization appointment, these steps will be completed as part of your overall appointment and may not be done in order. For the purpose of this demonstration, the following order is used. Step 1. Determine authority.
Hi, my name's Jessica. I'm a public health nurse and I'm going to be doing your daughter's immunizations today.
I'm Nadine. I'm Annie's mom.
Okay, great. Nice to meet you. And how old is Annie today?
Annie was born on December 21st, so she's just over 2 months old.
Okay, great. Well, you've come in right on time, which is definitely what we want. So we want her to get all her shots and we want her to get them on time. Not only will it help to keep her healthy, but it helps to protect others as well.
Step 2. Assess capability. Throughout the appointment, the vaccine provider assesses the parent's capability to give consent, taking into consideration such issues as cognitive functioning, hearing, and language barriers. Step 3. Provide standard information. Vaccine provider shows parent the health files for diphtheria, pertussis, tetanus, polio, Haemophilus influenza type B, hepatitis B, meningococcal C, pneumococcal 13, and rotavirus.
So we're going to be talking about immunizations today, and there's actually 4 immunizations that we provide to a baby at 2 months of age. It actually protects against 9 different diseases, and that's because one of the vaccines protects against 6 in 1. So it protects against diphtheria, tetanus, pertussis, which you might know as whooping cough, hepatitis B, polio, and Haemophilus influenza type B. Okay. Pneumococcal conjugate vaccine protects against 13 strains of that bacteria or germ. Meningococcal C conjugate vaccine also protects against that bacteria or germ. And then the rotavirus vaccine, which is a little bit different than the first 3 because those are actually injections or needles that will go into her legs. And the rotavirus vaccine is an oral vaccine, so it's a liquid. So we'll just put it into the corner of her mouth and squeeze it in, and then she'll swallow it. So that's something that we do first right off the bat.
Okay.
Let's talk a little bit about these. Did you have an opportunity to read these health files?
Yeah, I read them in the waiting room.
Okay, so you know that most of these vaccines are in a series. So what I'm going to do today is actually get your consent for all the doses of that series, and then we'll go ahead and put that into our computer system.
Okay.
Do you have any questions about the health files?
No, I think I've got all the information. I have a 19-month-old and a 3-year-old at home too, so I've read the information before.
Oh, okay.
The rotavirus was new with the 19-month-old, but it all seems like it's the same for this one.
You know what? With your 19-month-old, if you had the rotavirus vaccine, then it is actually still the same schedule. Okay. And just so that you know, here in your health passport, it actually goes through, tells you what she needs, what she gets next. So it tells you the 4 today and then what you'll get at 4 months.
Great. And if I can't make it for the 4-month shots, can my mother bring her in?
Yeah, definitely. That's no problem. So actually, from today, you're going to give me a consent for the whole series. Like, so for instance, this 6 in 1 vaccine actually goes at 2, 4, and 6 months.
Okay.
So you'll give permission for that whole thing. At 4 months, it's 3 of the same vaccines. So the 6 in 1 vaccine, the pneumococcal conjugate 13 vaccine, and the rotavirus vaccine. Now, what's a little bit different is the 6-month visit and the 12-month visit. Mm-hmm. So at 6 months, if it's during flu season, we give the influenza shot or the flu shot. And also for babies that are eligible, we also may give hepatitis A. And then at 12 months, we give 2 live vaccines, measles, mumps, and rubella, or MMR, and varicella, which you might know just as chickenpox.
Okay.
Okay, so I would have to have your consent to give those.
Right. Can I do that over the phone?
Definitely, that would work just fine. So what we would do is we'd talk on the phone, and I would explain the immunizations that we would be giving Annie, the common side effects, what to watch for, tell you about the diseases, and then if you gave me your consent for the series, we can put that into the computer, and then there would be no problem for your mom to bring her in.
Okay, that's really helpful, thanks.
And something that's good if you think that you may not be able to come or book all the appointments, you can actually do this text reminder card. So it's a new thing that we have with Immunize BC. You just text this phone number with your baby's date of birth, and it actually is going to give you a reminder for her routine immunization schedule.
Oh, that's great, okay.
Yeah, and you know, so many parents are texting now, so it's just something we thought, oh, this will totally fit in.
Step 4. Confirm understanding of standard information. The vaccine provider uses clinical judgment to assess understanding, including nonverbal cues, client questions, and clarifying the client's reasons for silence or refusing to engage in discussion.
So we've talked a little bit about the diseases and the 4 immunizations. Could you kind of give me a little summary of what you're expecting?
Okay, sure. So she's going to get the 3 vaccines in her leg,
yeah, exactly,
and the 1 oral vaccine. She might have a little bit of fever, soreness, and crankiness, a little bit of diarrhea.
Yeah.
And otherwise, I report anything else unusual to you.
That's exactly it. Wow, see, you got that?
And you want me to wait in the waiting room for 15 minutes?
Exactly. I mean, even though it's so rare, I still want you to be here, where if you needed an emergency treatment, I could provide it.
Okay. With my first 2, there was a little bit of swelling and redness in their legs.
That's normal, yeah.
Okay, and the first one had some fever, so I gave him a little bit of Tylenol, and he was okay.
Okay, that's great. And you know what? Right here in your health passport, we actually have a section on what to do if your child has a reaction following vaccines. So there's redness, soreness, or tenderness at the injection site. That's normal. You can put a cool cloth on there. And then for pain or fever, like you said, you can give acetaminophen, which is Tylenol, based on your baby's weight.
Okay.
Okay.
And anything unusual, I'd call the health unit or my doctor.
Exactly. I'd want you to go see your primary health care provider and call us back here at the health unit.
Okay. And you want me to wait for 15 minutes in the waiting room?
I do. Look at you, definitely, because we want to make sure there's no life-threatening allergic reaction. It's extremely rare, though. It happens in fewer than 1 out of a million.
The parent's reply demonstrates an understanding of the standard information. At this point in the clinic visit, the vaccine provider would complete the client's specific health assessment, eligibility, and contraindication determination. Step 5. Provide opportunity for questions.
So is there anything else that you want me to review with you?
No.
No? Any questions?
Step 6. Confirm consent.
Okay, so do you feel comfortable to give me your consent for these immunizations today?
Yeah.
All right, so can we go ahead and start to immunize?
Sure.
All right, let's get started.
Step 7. Document consent or refusal. Document that informed consent has been given or refused according to the electronic record guidelines per health authority.